أشرفنا. طيب، أولاً أريد أن أقدم لكم دكتور اللغة. دكتور اللغة هو أساس شركتنا. يدير أكثر من 100 عيادات حول العالم، وهو أساس شركتنا أيضا مع أتباعه في 2014 عاما. شركتنا قامت في تطوير أكثر من 10 منتجات، ومع أتباعه وعدد من أتباعه يجرون شركتنا لتبادل دعائه. أريد أن أدعو إلى شركتنا وعياداته في كل جمهورية، وشركتنا ترحب دائما بزياراتكم. عدد من الأبناء قاموا بزيارتنا في مالي. يسرعني أن أكون هنا اليوم مع دكتور أشرف ويراجع تقديم تحية له عندما تأتي إلى مصلحة. شكرا.
He's Korean, but he wanted to be more familiar with you. He can speak Arabic. Thank you. Thank you.
Thank you so much, Mr. Vincent. And now with Dr. Ashraf Badawi to talk more about the 10 p.m.
So we are talking about IPL, and this is, I believe, it's state-of-art fractional IPL, because this is the first fractional IPL in the world. And IPL has been known for many years that it's not suitable for dark skin because of the strong competition between the melanin epidermis and the deeper layers of the skin. So the traditional IPL were always not the safest, not the most effective in treating dark skin. However, now when we have fractional IPL, this changed the game and it put us in a different perspective. So let us dive a little bit deep into the field of laser and IPL and see what we have here. So we know that light is part of the electromagnetic spectrum, which is having the ultraviolet rays, and of course we have here the cosmic rays and the X-rays. We have the visible light, and then we have the infrared light, and after that the AM, AF radio rays. But what is important for me here are two important things. Number one, that this spectrum is split into two important categories: the ionizing radiation and the non-ionizing radiation. And this is huge, because if we are dealing or handling ionizing radiation, there will be always limit of exposure. You cannot be exposed after certain level. People who are working in the X-ray field, they have a badge which is measuring the exposure. And after a certain limit, they have to stay home. They cannot be exposed to the X-ray again because it's ionizing radiation and it poses change on the DNA. However, when we are working on the non-ionizing radiation, which includes the laser and the IPL and the visible light, there is no exposure limit. So if someone is telling me I got 200 sessions of hair removal, should I stop? No, because it's non-ionizing radiation, so we don't have that risk. The other important thing is that when we are working with the visible light, always there is a contraindication of lasers and light devices, which is photosensitivity diseases or photosensitizing medications as a contraindication. And this is unfortunately not a very accurate information. If we take it blindly, if we don't think a little bit deeper, then we are going to stop the light and laser practice when someone is taking photosensitizing medication, which can be an antibiotic like vancomycin, tetracyclines. It can be antihypertensive like thiazides. It can be even the Roaccutane, the isotretinoin, which is causing photosensitivity. However, this is not very accurate because we have to evaluate why should we stop using the light or the laser during photosensitivity. Are we using UV light? Are we using the excimer laser? Then yes, maybe. But if I'm using laser for hair removal, it doesn't make any difference because this is not ultraviolet rays. If I'm using ablative laser and causing wound, and the area we are working on is sun exposed, then this patient who's having photosensitivity might have higher incidence of getting post-inflammatory hyperpigmentation. So we always have to analyze and think why yes and why not. IPL is visible light, but it doesn't have ultraviolet, and some of the visible lasers as well. So that's why photosensitivity has nothing to do with that. We know that the properties of laser light is being collimated, monochromatic, and coherent. The IPL is non-collimated, polychromatic, and non-coherent. What does it mean? Collimated means that the waves traveling together are going parallel to each other. And that's why usually the spot size of the laser is small. With IPL, because it's non-collimated light, it can be larger. The laser is monochromatic, which means one wavelength, and usually this wavelength might be very specific, like alexandrite, which is targeting the melanin, or pulsed dye laser 585 or 595, which is targeting oxyhemoglobin for vascular lesions, and it might be multiple applications like the NDL, which is absorbed by water, by melanin, and by hemoglobin, and that's why we can use it for multiple applications. When we are working with the IPL, it's polychromatic light, and that's why it is targeting many chromophores in the skin, and then by using different filters or different pulse durations, we can be more specific on one chromophore rather than the other. And of course, the laser is coherent, which is having very high standardization. With IPL, it is non-coherent, so sometimes you can get different effects, even though we are using the same parameters. This is something called the absorption curves, and this is really very important. It shows us the different chromophores in the skin, the hemoglobin, which we target in order to achieve treatment of vascular lesions, the melanin, which we achieve to treat, we target to achieve benign pigmented lesions or hair reduction, and we have the water, which we try to target in order to achieve rejuvenation. So whenever we have, and those are the different wavelengths which we can use with different machines, and this is the absorption coefficient. So it's very important to know what we want to do with the laser, and then pick the right wavelength, which is going to be selectively working on the chromophore which we would like to affect. And there is a concept which is saying longer wavelength penetrate more deeply into the tissue. And this is something which we cannot generalize. It is true in a certain way when the curve of the absorption is going down, like this curve, then yes, the longer the wavelength, will have less absorption, and with less absorption we have deeper penetration. But what if the curve is going up? If the curve is going up like this, then the longer the wavelength will have higher absorption, and that's why it will have less penetration. For example, the NDAG is 1064. The ERBIMIAG is 2940. So the ERBIMIAG has a longer wavelength than the 1064. But because the ERBIMIAG is very highly absorbed by water, it cannot penetrate as much as the NDAG. So we cannot generalize this rule. The longer the wavelength, the deeper the penetration. It depends if the curve, absorption curve, is going down or going up. Some key terms to understand. Fluence is the total amount of energy that is delivered into the skin per surface area, measured in joules per square centimeters. Now, when we are talking about fractional device, then it's going to be a little bit different because we have to measure the millijoule per pixel. And that's why the total joule might be different than the millijoule per pixel, and this changes the equation. Pulse duration, this is very important. How long the pulse of light is in contact with the skin. It is measured in milliseconds or picoseconds or nanoseconds, it depends now. But also this is very important because we have to respect what is called thermal relaxation time. The thermal relaxation time is the time required by the target to use 50% of the acquired energy, and usually we have to be shorter than the thermal relaxation time of the target we would like to affect, and longer than the thermal relaxation time of the target we don't want to affect. So it's really very important to understand this so that we are able to fine-tune the laser machine in order to get the effect on the target we would like to have an impact on, and at the same time protect the epidermis from being damaged or burned. Hertz is the repetition rate, and this means how fast pulses of light are delivered by a device, and it's measured in cycle per second, which is hertz. And finally, we have cooling, the skin surface temperature. It is usually controlled, fixed, or no cooling. Some devices are having no cooling. The IPL systems 30 years ago were not having cooling. And that's why we had a lot of photos of complications of the IPL with the big footprint with skin burn, because it was not using cooling and because there was no possibility to use shorter pulse duration or longer pulse duration according to the skin type. Now with the advanced technologies, we are having a contact cooling handpiece with tunable pulse durations so that we are able to work on different skin types safely and effectively. The selective photothermolysis was introduced by Prof. Anderson and Parrish in 1983, and they mentioned that the matching of a specific wavelength and pulse duration to obtain optimal effect on a targeted tissue with minimal effect on the surrounding tissue. When I want to treat hair, I would like to damage the hair follicle without any impact on the epidermis. If I would like to treat vessels, I would like to have an impact on the antenna of the blood vessel, but without burning the skin, and so on. So this is the selective photothermolysis. In order to achieve that, I have to use a wavelength which is going to be selectively absorbed by the chromophore I would like to affect. I have to use the pulse duration, which is going to confine the heat into the target, but not to the surrounding area, and I have to use the appropriate fluence, which is going to achieve selective photothermolysis. If I use too low fluence, there will be no effect, and sometimes we get adverse effects. Have you seen a patient who came after hair removal with laser, complaining that the hair increased? Yes, this is a paradoxical hair growth. The parameters were not optimum, so instead of selective photothermolysis, we got photobiostimulation. So we increase the hair, we increase the blood supply, we increase the metabolism by low-level heating. So it's important to use the right parameters in order to avoid side effects. If we increase too high fluence, if we increase the fluence too much, then we get non-selective photothermolysis. The target is going to be affected, but the heat produced is going to be too much, so it's going to affect the surrounding tissue as well, which we don't want. For the skin, this is, we all know, we have the epidermis, the dermis, and subcutaneous layer. Each of those layers is having certain structure with certain function and contributes to how the skin is looking in a certain way. And each of those three layers is having changes which happen with aging, which is affecting the structure and the function and reflecting the skin, which we call the signs of aging. So when you have a patient coming for acne, or wrinkles, or large pores, or laxity, it's really important to evaluate each of those layers, because it's not enough to stimulate the collagen for someone who's having acne scar, or it's not enough to work on bleaching the skin if the patient is having melasma. The optimum outcome is rejuvenation. The optimum outcome is to restore the structure and the function of the skin, regardless what's the main problem the patient came with. This is how we are able to improve the quality of life. This is how we are able to let the patient feel that we did something for them. And that's why it's really very important to have a plan to work on different layers of the skin. Now, with this IPL, with the 10PL, we have 3 filters. We have the 415 nanometer, which is going to affect the epidermal pigmentation, mainly, and acne. And then we have the 570 nanometer range, which is going to work on pigmentation and skin rejuvenation. And then we have the 590, which is going to work on vascular imperfections, superficial vessels, and the erythema. So those are the 3 categories which we can select from. So the applications would be photorejuvenation, treatment of rosacea, hyperpigmentation, telangiectasia, melasma management, and poikiloderma. Now, when we say treatment of rosacea, this is in order to decrease the erythema associated with the rosacea. It's not going to treat rosacea. If there is pustules, papules, this needs medical treatment. So again, we have to understand our tools and know which part of the pathology or the pathogen is going to work on. The same for melasma. We know that once melasma, always melasma. There is nothing going to cure melasma. And actually, if we treated something wrong, we can worsen the melasma. So it's really, again, important to know what we are going to do, what's the objective of that, and if it's going to be long-term improvement or temporary improvement. And then sometimes we use it in combo treatment with amino-hyaluronic acid for PDT in certain conditions, because ALA is going to be activated by light, and in this case we are going to be using the 450. So the pulsing mode, and this is something which is really very unique in that device, where we have 3 pulses. Pulse 1, which we can determine how long it's going to be, and then we have a delay, which again we can control, and then pulse 2, and delay, and pulse 3. This means that we are able to deliver up to 3 pulses with certain gaps, and this is changing the game of using the IPL, increasing the safety, increasing the efficacy. So this is regarding the pulsing mode. When we are able to change the parameters like that, with the pulses, control the pulses, then we are able to treat even darker skin types. Asian skin is very much prone for hyperpigmentation, and it was not easy to treat it before with IPL, but today with the tailored pulse modes and pulse durations and delays, we are able to treat all skin types, including the Asian skin, which is very much prone for hyperpigmentation, safely and effectively. So we have also to be familiar or know that different skin types respond differently, and darker the skin, the bigger the target hold the heat longer. Reactions could come out that night or the next day, depending on skin type. Sometimes we used very long time back to do perform test areas, test spots, and we waited a little bit in order to see how the skin is going to react. When the skin type is 5, sometimes we do the test spot, and we wait for half an hour, nothing happens. So we continue the treatment, and then the patient comes next day burned. Why? Because the reaction is going to take time in order to show. So the darker the skin, it's important, if you are going to test the skin, to wait a little bit to make sure how the skin is going to react. However, today, with a better cooling device, with the more tunable pulse durations with the different devices, including the 10PL, this is becoming much safer and much better to control. IPL loves color, and that's why the darker the skin, we have to be careful. We have to use very good cooling, and we have to use longer pulse durations with good delay between the pulses in order to avoid complications. What is photorejuvenation? It's a non-invasive, non-ablative, intense pulse light which simultaneously treats epidermal, dermal pigmented, and vascular lesions, as well as improving the skin appearance. For pigment rejuvenation, it's very important when we work for that to clean the skin from all makeup and moisturizers and topical numbing creams. And this is really very important, because if you don't do that, then the delivery of the light or the energy of the light to the target is going to be much less. And then there will be no result. So next time we need to increase the energy. When we increase the energy, this is going to increase the risk of complications. So if we clean the skin well, then the optical penetration of the light is going to be much better, and in this case, less fluence is going to do much better job. It's important to determine what skin type we are using, and in this case, it's not only the Fitzpatrick classification of skin, because sometimes you might have two patients of Fitzpatrick 3, but one of them is from Asian origin, and the other one is from Mediterranean origin. Patients with Asian origin are having a higher incidence of hyperpigmentation. So it's very important to consider the ethnic origin of the skin in addition to the Fitzpatrick classification. And it's important also to know what pigmented condition is being treated. And that's why it's important to have those devices in the hand of the dermatologists, because the dermatologists are able to define if this is a benign lesion, suspicious lesion, or malignant lesion. If it is a beautician who is using IPL, then anything brown she's going to treat, regardless of what it is, right? So it's really very important to know what is the nature of the pigmentation. Is it epidermal pigmentation, or dermal pigmentation, or compound, or it is something other than pigmentation. And then we choose the filter for the condition we are going to treat. And then we determine the starting fluence based on the Fitzpatrick classification, and always it's important to start safe. And then the pulse duration based on the size of the chromophore, and we know for a fact that the larger the chromophore, the longer the pulse duration, and the less the fluence. If you are trying, this is a different example, but if you are treating dark, thick hair, then we use longer pulse duration and less fluence. But if the hair is becoming finer, then we decrease the pulse duration and increase the fluence. The same applies for pigments and for vessels. If you are trying to treat dark pigment, then less fluence and longer pulse duration will work. But if the pigmentation is faint, then it's just the opposite, shorter pulse duration and higher fluence. Before treatment, a test spot must be always be performed to optimize parameters and check possible side effects, especially in dark skin. There are some positive endpoints, like darkening of the lesion. If you are treating epidermal pigmentation in particular, we expect some darkening of the lesion, and this is a very good endpoint. Then slight edema of the skin around the pigmented spot, this is also okay. And slight edema might happen in some lesions, especially when we are working on the dermal pigmentation, because the heat is deposited in deeper layer. Tingling, not burning sensation is usually felt. Skin might appear to have coffee ground look. I'm going to show you some photos. This is totally normal, but it's important to let the patient know that this is going to happen before it happens, because this is called patient education. If the patient came back complaining of that, then, and we try to explain, this is called apology. We did a mistake and we're trying to apologize. So it's always better to educate the patient, spend enough time with the patient explaining what are the expected changes to the skin after the procedure. Usually the interval between the sessions should be 3 to 4 weeks in between. And melasma is one of the conditions which are challenging, and that's why every session or every conference of dermatology is going to have a session about melasma. Every meeting we are going to talk about melasma, because till now we didn't find a cure for melasma. But it's very important to know that melasma is affected by the UV exposure. Let the patient who is going to do a procedure and pay money that this is not a cure. Melasma is going to come back, and we tell them, we teach them that melasma is just like the diabetes and the hypertension. No one is taking the medication of diabetes for 1 month and stop it. This is a treatment for life. Treatment of melasma also is for life. When we are working with energy-based devices, lasers, IPL, with melasma, we have to be as conservative as possible to shatter the pigmentation, not to irritate the skin, so that the skin is not reacting by producing more melanin. And at the same time, we have to use bleaching agents. We have to use topical agents. But before using topical agents and bleaching agents, it's important to improve the epidermal barrier functions with retinol, with whatever, so that when we apply something for bleaching, it's going to be absorbed. If this is not the case, if the patient is having photo damage and hyperkeratosis, whatever we apply on the skin is not going to be absorbed well. It's going to be absorbed by thick layer of corneocytes, which is not going to be effective So it's important to improve the ectodermal barrier function to have better absorption of anything we apply topically for bleaching. So this is part of the game. Solar facial linkage lesions, this is something which can be treated very successfully with IPL, keeping in mind that this is much more common in skin types 3, 2, and 1. And those people are having photosynthesis. So IPL can work very successfully in those conditions, but we have to educate the patient that if you keep being exposed to the ultraviolet with the same pattern, you will get them back. So it's very important to let them know that sun protection should be part of their routine life in order to prevent recurrence, even if we treat it successfully. Sun damage to the chest, this is something which can be treated very nicely with the IPL, having a large spot size and being able to treat large area in short time, this is a great advantage. Hand linkage leads also can be treated very successfully with this IPL system, and in different pigmented lesions, it is one of the good choices, especially as I mentioned, skin type 1, 2, and 3. Skin type 4, we have to tailor the pulse duration to be able to target the pigment without damaging the epidermis. Now, this is a very important concept which really I wanted to highlight today, because this is a concept which we did not have in mind before. This was a publication in 2012, which means about 11 years ago. And it was about rejuvenation of gene expression pattern of aged human skin by the broad Badawi. So it's an IPL. And this was published in the Journal of Investigative Dermatology, as I said, 11 years ago. So what is the background of this study? Scientists have demonstrated in a rat model that they could restore the gene expression of old skin to more resemble that of young skin. And the skin cells exhibited traits of stopped or slowed aging. What's the story here? The story is that when we are born, we have all the genes responsible for everything happening in our bodies. We have genes which are very active when we are young, responsible for all the rapid metabolism, rapid turnover of cells, good circulation, good production of ATP by the mitochondria in our cells, and so on. Those genes are very active when we are young. And there are genes which are responsible for the changes happening when we age, like slow metabolism, like poor circulation, like slow proliferation of cells, and so on. And those genes are very much inhibited when we are young. While we age, we start to see the shift. The genes of old age are starting to be stimulated and more active, and the genes of young age are becoming more inhibited. This is the process of aging. So here the scientists in the rat model, they were able to do changes or stimulations in order to change or restore the gene expression again, stimulate again the genes of young age and inhibit the genes of the old age. So the conclusion of their study in the rat models or animal model that the aged cells were functionally rejuvenated. So the question was, can this concept apply on human skin? So the study objective was to determine, can we reverse skin aging in human skin? And can IPL treatment cause wounding or scarring on a functional level? Those were the two questions they wanted to answer by this study. So what they did is that they did histology to view the changes in protein levels and structures, the collagen mainly, and they did DNA study in order to evaluate what will happen at the level of the genes. What they found is that the RNA expression or the gene expression of IPL-treated older skin was more closely resembling the young skin. Rejuvenated gene included several key regulators of longevity, lifespan, tumor suppression, and none were associated with wounding or scarring. So all the genes responsible for longevity, lifespan, and tumor suppression were activated, and nothing was associated with wounding or scarring. And the conclusion of this study was that the expression of over 1,000 RNA or genes became rejuvenated to be more like youthful skin, resulting in decreased elastosis, more order and uniform collagen deposition, improvement in fine wrinkles, pigmentation, and vascular lesions. So this means that if you are doing something for the skin to try to restore the structure and the function of the skin, you are not only improving the appearance of the skin. We're improving the structure and the function of the skin and the gene expression, and this means it is an anti-aging procedure. But this requires that we target all the layers of the skin. And then what they did is that they had blinded evaluation for the treated skin, and patients who maintained a regular regimen of treatments annually can reduce and delay the long-term signs of skin aging in a way that looks very natural, and I think this is today a big demand of our patients. They want to look natural. So when we are doing a number of procedures, maybe 2 or 3 sessions of IPL rejuvenation, this is not enough. Then what happened here is that they maintain to do 2 or 3 times per year those sessions, along with what we are doing to improve the epidermis, along with what we are doing to tighten the skin, and we maintain that. And in this case, in 10 years, the skin is going to be looking much younger than today. And this is an example. This is Patrick Bitter, one of the authors of that study, who had those IPL treatments continuously for 10 years. And this is when he was 43 years, and then when he's 55 years, I think we can all agree that he looks much younger than when he was 43. And during those years, he had 33 sessions. Is that too much? In 11 years? This is 3 sessions per year, so as maintenance. And this is again his forehead, 43 and 55. This is a time of 11 years, 5 months, and he had 33 treatments, 3 treatments per year. And this is another patient when she is 38 in the same group, and then when she's 49, her skin is looking much younger and much better because we stimulated the skin and we changed the gene expression, and I think we agree that the skin is much better. This is one of my patients, whereas I started to treat her from 2020, from September 20, and in March, this is her skin after 3 years. I think we agree that after 3 years, she's looking much better. Her skin is looking much younger, much healthier. And by the way, she had melasma. We did not treat the melasma, but we put it under control. This is her skin in 2020, and this is her skin now after 3 years, and we can see that her skin is much better by following the protocol of using the IPL in order for photorejuvenation, control the melasma, using something to improve the epidermis, and using something to tighten the skin. The same patient, and we can see the improvement. We do 3 sessions on monthly basis in the beginning. And then after those 3 sessions on monthly basis, we do 3 sessions per year, which means a session every 4 months. Okay? This is another patient who had melasma as well. I treated her with a 10 PM. We can see that the melasma, maybe it improved a little bit, but we can see in general that the skin is tighter, it's healthier looking, and this is 1 month apart. So I did only 1 session for her. Today she had the 2nd session, and next month she's going to be the 3rd session, and then we'll start the maintenance along with topical vitamin C, bleaching agents, retinol to improve the epidermis, and of course sunscreen. And this is the same patient. I think we can see that things are starting to be under control, and this is only 1 month or 3 weeks even, 28th of August, and this is today. And this is another patient who had acronosis, and it's really very difficult to treat. We have been trying to treat her for a long time, it didn't work. We did the 10 PL, of course, we had some the coffee ground appearance, which we told her before that's going to happen, so that's totally okay, and things are described even in the company literature and studies that this is something which can happen, and when that happens, it's much safer than if you are having an IPL which is not fractionated, because this is going to be very temporary. So we can see that the skin improved. This is after, again, 3 weeks. In general, the skin is much better looking. We still have to continue, but even in that dark skin and this resistant condition, we are able to improve it slightly, and the texture of the skin can really improve. This is when she had the skin reaction, and this is after 2 weeks where it improved really significantly. This is another patient who had melasma, and those are the parameters I used. So with the device, we can select either the 415 filter for epidermal pigmentation, 570 for the dermal pigmentation, or the 590 for the erythema. And then we can see here, this is the fluence, which I don't prefer to use more than 12 in dark skin. But then we have here the pulses. So pulse 1, which was 10 millisecond, and then we had delay off, which is 30 millisecond, and then 5 milliseconds, and it was 2 pulses only at that stage. And this is the procedure. So of course we have to use cooling gel. I applied it on the tip, and then I evenly distribute it. This is going to cool the skin. And then we start the IPL treatment. One of the important things is that we have to press the skin well so that we have good cooling on the whole surface. If we are trying to work on curves and certain areas were not cooled because it's not in good touch with the skin, then this is where we can see some skin reaction, which is exaggerated. So this is the 570 for dermal pigmentation. Usually I do one pass with the 570, but then I'm going to shift to the 415 for epidermal pigmentation, and this is the parameters. 415, I select the other filter, and then I start to work to do another pass so that I'm targeting the dermal pigmentation, then the epidermal pigmentation with the same technique. On the same area. So, and this is the outcome. So this was her today. There is improvement. Maybe it's not significant. We have to do more. But she was very happy. She said that I didn't see any improvement like that before from any treatment I conducted. So it means that we are really able to improve the structure and the function of the skin. The 10PL is a good device where we can use it in certain things. Of course, the epidermal barrier function requires treatment and work on the epidermal barrier function by certain devices to improve the epidermis. And we did some tightening as well with infrared laser in order to tighten the skin. Now, this is epidermal pigmentation where we can see a very nice improvement with the 415 after only one treatment, but we have to let the patient know that sun protection is a must afterwards so that they don't have recurrence of the freckles. And this is another case from Korea where we can see photo damage which has improved, and those were the parameters. So the 590, because there is some erythema and vascular lesions, and they used 14 joule per centimeter square. The skin is fair, with 20 milliseconds off, and then 14 joule was 5 milliseconds. So we can see the extent of the improvement, and when that happens in Asian skin, this is excellent because it's very much prone for BIH. And thank you very much for your attention.
Thank you so much, Doctor.